Hello, I'm Kaitlin Klein, and I graduated from Forest Park in 2010 and the University of Evansville in 2014. My major instrument was violin, and I did a little bit with flute and voice as well. I have a Bachelor of Music degree in music therapy, a minor in psychology, and a Suzuki pedagogy certificate, which means I can teach violin using the Suzuki method. After getting my degree, I completed my music therapy internship in Cleveland, Ohio at University Hospitals. And when that was finished, I moved back to Ferdinand and worked there for only about 6 months. I did contract music therapy work, traveling to clients' homes, working with people with disabilities, and I taught Suzuki violin. So between the two of those, it was a good combination for me, and it was almost full-time. I worked a lot of evenings and did a lot of traveling because, like I said, I went to people's homes, so it was a lot of driving in the rural area. And when I moved to Cleveland for my internship, I thought I would hate Ohio and hate the big city. And I was totally wrong. I missed those things, so I ended up moving back to Cleveland, and now I work at the Cleveland Clinic. I've been there for over 4 years now. The hospital population is my favorite population to work with music therapy. I've also taught a little bit of violin, just having 2 to 3 students at a time. And I also really like that now my job is more 8 to 4 instead of a lot of evenings. Now I live close to Cleveland. I live in Akron with my husband and 2 daughters, and I really love what I do. I love that I have a team at the Cleveland Clinic. I work with at least 7 other music therapists and a few other art therapists. We cover inpatient and outpatient groups, as well as children and adults. So that's where I am right now. Backing up a little bit to high school, I first heard about music therapy. I think I was around a sophomore, and it sounded perfect to me. It was using music to help people, but I thought that sounded awesome. But I didn't understand what it was. I looked up definitions online, which is something like using music to address the needs, physical needs, emotional needs, etc. of your clients. And that to me sounded really nice, but I didn't understand what exactly that meant. So I emailed a music therapist in Evansville, and she was telling me more about it. It sounded pretty interesting, but I didn't quite grasp it. And I was considering some other careers as well. And something that really stuck with me, I was talking to various people about what career path to choose, and a student teacher of mine said I realized I could go my life living without being an engineer or being a lawyer or being a doctor, whatever. But I didn't want to live every day without music. And that's what kind of sealed the deal for me. I knew music was extremely important in my life, so I decided, at least at that point, to give it a go. So I went to the University of Evansville, majoring in music therapy, got to my introduction to music therapy class, and was like, oh, this is what it means. Going through all the different populations you can work with and how you can apply music to help other people. I could talk for hours about music therapy and the benefit, who we work with, and all of that. But I think for this short video, I would just say to go online to get all of those details. Musictherapy.org is a great place to go. It's the American Music Therapy Association. Just a little more about maybe my personal experience. As a music major, I don't think it matters what degree path you're taking. It's a lot of work. You have other classmates, other people in school who have 15 credit hours, and it means 15 hours of class a week. And you might be taking 20 credit hours, and it means 35 hours of class and rehearsal, on top of practice times and other obligations you have. So it's a very intense career to have, or a major to have in school, and you really have to work hard. But I think having your music school community there and the passion for music really, really helps. Something about music therapy that I found interesting in school was that the stereotype is that the music therapy majors are those musicians who want to have a music degree, but they can't make the cut for performance and they can't really teach, so they just have to go with therapy. Well, that's absolutely not true. As a music therapist, you have to have a major instrument, so mine was violin, and then you have to be proficient and pass tests in guitar, keyboard, voice, and percussion. And then once you can play those proficiently, then you have to learn how to apply them and take psychology classes to help you do that, take music therapy technique classes to help you do that, apply those things. And as you're playing the music, working with a client or a group of clients, you're paying just as much, if not more, attention on them and their responses and what they need than you are on the music. So your music has to be so good that you're able to do that. So really, I think music therapy is very challenging. You're not just performing. You're not just taking one avenue. You are really adapting the music. You're using techniques like improvising, recreating music, receptive techniques like listening, composing music, all of those things with your client to help their goals and needs. Like I said, that was just really brief, but I could go on for a very long time about that. After you finish school, you have to do a 6-month full-time internship in the population you're interested in. So I chose to do mine in Cleveland, like I said, with adults in the hospital. And that is where I love to practice the most. So I see inpatient adults. My top goals I work on are pain, anxiety, normalization of their experience in the hospital, psychosocial issues, just a huge variety. Sometimes physical issues if I'm working with a stroke patient. A lot of adapting coping skills is really huge. So I'm working on these things using the client's preferred music. I love my job because I live in a place where I have to work with people from all over the world. So I'm working with Spanish music, even Arabic music, country, hip hop, you name it, every kind of music. I'm constantly learning and learning how to adapt that to my clients. I find that very challenging and very exciting and very satisfying when I'm working with those clients. I love my job, if you can't tell. There are, I think, more music therapy jobs in populations like children with disabilities and maybe working with the elderly than there are hospital jobs. At this point, they're a little more competitive to work in a hospital. But I think that'll change in the future as more hospitals see the benefit of music therapy and more positions become available across the United States. There's a lot I could say. So just to wrap up, I think my advice for if you're considering a career in music would be to have a game plan and a goal in mind. What job do you want? Or where do you see yourself 5, 10, 25 years down the road? Like, do I want to be a music teacher? Do I want to be a therapist? Do I want to perform? Do I want to do something else, specifically with music? And then talk to somebody about what that is actually like. I think when I considered briefly music performance, that seemed really vague for me. I didn't know what I wanted to do with that degree. But with music therapy, I was like, I'm going to be a therapist. So I think thinking about those things and then talking to somebody, asking tons of questions to actually get an idea of what they do. I didn't even go into a typical day in my hospital job, but that would be something important to ask. And just knowing that if you have a passion for music, that's awesome. I would do what I suggested. And also know that even if your day job is music, you can and should use music outside of work on your own for enjoyment and self-care. I think that can help with things like burnout and just help you find fulfillment overall, so you're not just doing it for your job. And also know that if you don't have a career in music, music is always there. And I have so many people, like so many patients I work with in the hospital say, oh, I played the clarinet in high school and I wish I would have stuck with it. So many people say that. So my biggest advice would be, career in music or not, stick with music at some point. Do it for yourself. Never, never let that go. Music is always there, and I think it is so important for the world, for the soul, that just never give music up.